Welcome to Global Academy of Medical Education. I am Dr. Saif. I am here to give you a quick recall for the full questions of community medicine NEET PG 2023. I hope you have done well in your exams. So, without wasting time, let's come on your first question. That is, what is the best parameter for the assessing health status of the community and is also a sensitive indicator and for the availability and utilization of health services. So, here it is IMR, infant mortality rate. I have already told in my lectures that infant mortality rate is the best parameter for assessing health status, and here HDI contains three parameters where infant mortality is not there. It is life expectancy at birth is there. Okay. Knowledge, life expectancy at birth and income. Okay. These three parameters are in the HDI kill. Okay. So, infant mortality rate is the best answer here. Next question is the cement worker industry Xray changes was seen and mesothelioma of lungs. We all know that in the pneumoconiosis I have told that this is a specific type of cancer which is found in the asbestosis. Okay. This mesothelioma of lung, the most specific type of cancer, in the pneumoconiosis is called asbestosis. So, this should be the answer of asbestosis. Okay. The next question, that is an alcoholic with a vitamin deficiency. So, what vitamin deficiency in the alcoholic? We all know that thiamine, vitamin B1. Okay. Some another is because it is based on recall. Some also said that the question was not with alcohol vitamin deficiency, but if it is related with the polished rice. Okay. So, there in the polished rice also vitamin B1 deficiency is there, thiamine deficiency is there. So, in both questions the answer should be thiamine. Okay. So, next question, it was asked that 97.5% of the population is able to cover the dietary requirements of the population. So, means if 100 people are living, the recommendation should fulfill the dietary requirements of 97.5% of the population. Okay. So, that should be the called RDA, that is called recommended dietary allowance. That should be the answer. Okay. Now, coming to the next question, that is a poor farmer with a history of successive crop failures develop progressive spastic paralysis, upper motor neural signs, gait instability. So, these are all related with called boa toxin. The toxin is boa toxin, beta oxalyl amino alanine. It is related with the khesri dal. Okay. It is related with the khesri dal, and the toxin is called boa toxin, called lathyrism. Okay. That should be the our answer. Now, a new question was there, that is what is the columoplan? That columoplan is basically used for the socio-economic development of the Asian countries. Okay. Southeast Asia, basically Pakistan, China, India, Bangladesh, Sri Lanka. These are the countries which are included in the columoplan. Here basically the cobalt supply for the medical colleges. Okay. It was in the Colombo plan. Okay. That should be the answer. Next question is 30-week pregnant ladies not eating papaya, thinking that it is abortifacient. So, who will counsel her? So, the question was very tricky because usually the nutritional requirement was given by the Anganwadi workers, not the A&M. The option was also an Anganwadi worker. So, in the Anganwadi worker, the nutrition requirement is there. Okay. Option was Anganwadi worker. So, nutritional supplementation was given by Anganwadi worker, but Anganwadi worker usually don't give counseling to the mother. Basically, Asha is the one who counsel mother for the nutrition. Okay. Because here counsel or advice was given in the question. Counsel or advice was word were used in the question. So, this answer should be the Asha. Otherwise, who will provide, if the question was who will provide it, so provide it is provided by the A&M. The nutrition requirement, the protein, calories and food is usually provided by the Anganwadi worker. Okay. So, that should be the answer. It's a provide is word is used, but here is the counsel word is used. Okay. So, coming to the next question, person with low BP in childhood to have low BP in adult as vice versa. For example, if anyone has a low BP, so gradually by hardening of the artery the BP will be like that. If BP start from that, it will that. So it is kind of a graph, it is in your book as well. So higher the BP, higher in the end stage of life, more higher will be the BP. So gradually BP will increase. It is called the phenomena, it is called tracking of the blood pressure. Okay, that was the question. Okay, this was already in your books. I have already studied and told you about that. Now coming on, patient having sputum smear negative and Xray is positive under National Tuberculosis Elimination Program. What is the next step of management? So here the sputum smear is negative and Xray is positive. Okay, the chest Xray is positive, but now most of the place now CB-NAT is also done, because most of the time sputum smear is negative and CB-NAT if only in 10 bacteria is available. Okay, because for the sputum smear 10,000 bacteria is required for the slide to become positive, and only the 10 bacteria is there and CB-NAT will be positive. So CB-NAT should be done for each and every person for the diagnosis as well as diagnosis for the MDR as well. So rifampicin resistance can be discovered and the drug treatment can be given accordingly. Okay, so CB-NAT should be done in this case. Okay, another question was the aniline dye worker is a 20 years old worker. There basically it is for the method study design was asked. So here question was asked that in the here the cancer was already been occurred, but they are thinking about the exposure. Okay, exposure to disease. Okay, they are following like this. So they are first find out the exposure, and group was made with control who don't have exposures, without exposures, not control, without exposure and with exposure. With exposure with aniline dye worker, and without exposure the clerical staff or office staff. Okay, so office staff is the without exposure and the aniline dye worker is with exposure, and bladder carcinoma is seen. So here it is when the study is done from back to forward, it is a kind of a prospective design from the back side. So it is called retroprospective. Okay, sorry, retrospective cohort study. It is a kind of a cohort study which is follow up study, but it is from the back data. So it is called retrospective cohort, or if it is followed further, so it is called retroprospective. So here it is not followed further, but only from the back to today. So from back to today it is called retrospective study cohort, and if it is from today to the backward design like that, it is called case control. So here it is exposure to disease is followed. So from exposure to disease is called cohort study, and from disease to risk factor it is called case control study. Okay, so here it is asked this according to the question. So answer will be retrospective cohort. Now coming to the next question, a 10-year-old child in urban mission school was there, and it can be vaccinated as per NIH. So in the 10 year, earlier it was TT was given, now TD is given. Okay, tetanus and diphtheria low dose. Okay, this is given, this should be our answer. Okay, next question was Koplik spot is found in the basically in the measles. Okay, another question, vaginal discharge kit color. Okay, so in the vaginal discharge green color kit is used basically. Okay, green color kit is used in which sectinidazole and fluconazole is given. Okay, in the green color vaginal discharge kit. Okay, another question is, statement was asked, statement was true, that many of the statements given are regarding the height and weight gain, growth development, but we all know that at birth 50 centimeter is the length of the child, and in the 1 year 25 centimeter is gained, it is 75 centimeter, and the next second year it is nearly about 87.5 centimeter. Okay, in the next year, in the 4 years it is nearly equals to 100 centimeter. Okay, so in the 4 year the height becomes double. Okay, but in the first year 25 centimeter is gained, that should be the our answer. Okay, 75 centimeter should be the height in the first year, or 25 centimeter is gained. Okay, that is our answer. Year potential life loss, YPLL is basically it is lost to the premature death. So how many premature deaths were there due to the For example, if any child is 3 years old and the life expectancy of the country is 62 years and this child died by the accident, so 59 years is potential life loss is the 59 years. Okay, so it is asked in the question. Bacteriological assessment was also asked. Regarding bacteriological assessment of water sample, there many questions were very confusing statement was there, but for any assessment of bacteriology of water, we simply open the tap and run water for 1 minute, so that the bacteria inside the tap, dry tap, they will not contaminate the sample. After 1 minute, the sample is taken and the sample is taken from sidewards, so that no splashing is done. So the best option will be basically allow some water to flow, then collect. This is a true statement. This should be our answer. Okay. Another question was very confusing. Someone told me that it is related with the pellagra, but many of them told them that this alopecia, perioral dermatitis and thinning of hair was there. So this is basically the feature of the zinc deficiency. Okay, and is called acrodermatitis enterohepatica. Okay, so zinc deficiency should be our answer. If it is not there, then if dementia or dermatitis or diarrhea is also given, so it is related with the pellagra. So pellagra and zinc deficiency is very close, but if hair is alopecia, perioral dermatitis and thinning of hair is there, then it should be zinc, and if it is related with diarrhea and death or dementia, it is related with the pellagra or called niacin deficiency. Okay, so both can be done because it is a recall based question. So that is all about all the recall. I hope you have done well. So all the best for your results. Good day.